I'm Deborah Klein Walker from the United States. I'm a past president of the American Public Health Association. And actually, our organization's designee, or one of designees to the World Federation Public Health Associations. I've been active with the World Health Association since I was president of APHA in 2006. I've gone to the prior, I believe it's 6 or 7 meetings, and I am currently the co-chair of the Committee on Women, Children, and Adolescents for the World Federation. My one world would be unity and collaboration and commitment to public health. That's not one word. So I guess one word would be excitement. And that's excitement for people coming together. I mean, we are having a really tough time with challenges to public health in the United States. So I'm looking forward to meeting other people who are committed and supportive of the goals of public health using a science-based approach. When I return home from this event, I'm really hoping for serious change, which I think that the World Congress will support. But I think, again, I'm looking forward to feeling commitment and support for a science-based public health approach where facts are key and public health professionals are respected. I'm also looking forward to a recommitment with my colleagues in the United States to actually overturning many of the disastrous decisions that have been made around public health. And I'm hopeful that the US will recommit and join WHO and be a world leader in public health as it has been in the past. Having attended a lot of the congresses and observing what the different congresses have discussed, I feel one of the things that's really interesting is observing the various cultures and countries and resources discuss public health. What is fantastic and probably not surprising to many is that, of course, everyone has the same goal for a world that has the optimal health for everyone, where there's a reduction in inequities and a real commitment to a planet that supports all of us. So I'm hoping I've observed that actually in several of the conferences and thought it's interesting to observe, even though there are different languages and different approaches to public health from the different countries. But I've always found that people in public health, no matter where they are, no matter what government they live under, et cetera, share the same goals and aspirations. So that's really a big lift to one who goes to the conference. Just thinking about the conferences and what are some of the ideas that have come up. One of the things that happened at one of the conferences, which I still work on today, is the really emergence of the Women, Children, and Adolescents Work Group, which is now really stronger than ever. So the theme of focusing on women and women's conditions around the world is one of the things that I've observed and taken from the conferences, and we've put that together in a very strong work group. Because I feel like, as a person who's lived a long time and actually understands all of the improvements the West has made since the Second World War, and creating countries that go across and share many of the same values. And I've observed that, and now I'm really observing that many of those that's being challenged in many places. So I'm hoping that the theme will show once more how public health really can't be contained by one country or within borders. It really is, by its very nature, something that has to cross borders. And I hope that we will have and can reinstate and support structures across the world that will help us do that. I were there and was given the microphone for the last session and address. I would use it as a call to action for all those who believe in the public health, which is the science of using the best work and research that we have to make the healthiest nation and world. I would want people to come together and regardless of where they live and think about how to put together the best options we have. There are so many things that are challenging us in public health, from war to governments to misogyny, racism, etc. We have a lot to do to come together to make the best outcomes for every single individual living on this planet. And I think our recommitment to doing that is something that I would really charge audiences to do as they go home from the conference. Well, I'm really excited for the upcoming World Conference. I know that the World Federation has sponsored many of these in the past and knows how to bring a lot of key themes and people together. Public health is multidisciplinary and therefore really needs to seize on the moment of bringing all of those parts together to actually define an agenda and renew our commitment as a global community to the best health and outcomes for all individuals.